Good evening and warmly welcome to the info event of coronavirus situation for the guardians of comprehensive school pupils. Helsinki has entered to the community transmission phase of the coronavirus pandemic. Today, we will discuss the impact of the coronavirus on the operations of the schools and the measures with which we can jointly curb the spread of the virus. We have received questions from you and we will go through them in our presentations as well. Next, I will give the floor to Sanna Isasompi from our epidemiologic operation. Sanna, please welcome.
Thank you. And good evening from my behalf as well. I'm sitting right now at the headquarters of the Corona epidemiological work here in Kallio. And let's go through some of the main points I would like to make this evening. So here is the epidemic curve of this coronavirus pandemic in Helsinki. We have the first wave in the spring. The height of it was in April. Summer was easy, as we know, very few cases. And as autumn began, we started to see gradually some cases, and by October, we were getting towards the acceleration phase. And now, as Mario mentioned, we are in the community transmission phase, seeing rather many cases per day currently. About this novel coronavirus, which is called SARS coronavirus 2, which refers to its predecessor that was going around 2003. This coronavirus is transmitted mainly by droplets and by contact. We know that it can be transmitted by aerosols, which are kind of small droplets that can float in the air a bit longer away from the infectious person than usual droplets. But this is not as common as droplets and contact as a means of transmission. Incubation period for the disease is from 1 to 14 days, and it's most often 4 to 5 days. This means the period from the contact with the infectious person to the disease to begin in the next person. And we know that before a person develops symptoms, 2 days before, they can transmit the disease onwards. Symptoms of this coronavirus infection are common cold type respiratory infection or diarrhea type of symptoms. Something that is slightly specific but not doesn't occur in nearly that many cases is a loss of smell and taste. When it comes to symptoms, it is impossible to distinguish coronavirus infection from the other sort of usual type of causes for these similar symptoms. So we have to take a diagnostic test in order to know that this is about coronavirus case. Diagnosis is confirmed by taking a nasopharyngeal swab, which is a sample from the nose. And it is usually analyzed by so-called PCR technique. An antigen test can be used as well, but the PCR is the golden standard we mostly use. How to protect oneself from coronavirus? If a person develops these symptoms, it is very important to get tested. And this is regardless of the age. So it's important to get tested, young children, older children, or adults. And when you develop symptoms, it's important to start sort of immediately to reduce contact to other people in order not to pass the disease onwards. So it's important to stay at home. When it comes to school, if you or your child develops these symptoms, it is important not to come to the school premises while sick. Preventive measures are something that are not said too many times in this time of the pandemic. So maintain good hand hygiene. It is very important, and follow the coughing etiquette. When you are moving around, keep a distance at least 1 to 2 meters to other people. This is very effective way of reducing droplet transmission. And wear a face mask. It is effective as well. The more we use face masks, the more effect it has in our community. We have a Koronavilkku mobile phone application as well. It's a very good and effective way of letting other people to know about your infection in a way that your anonymity is maintained, and it's a very data secure way. So this is something I suggest for you to upload. About the use of face masks. So the general recommendation, very warm and strong recommendation, is for those persons who are over 15 years old, when close contact with other people cannot be avoided. If younger people feel that they can use mask, it's okay. So there is no harm, but the general recommendation goes from that age onwards. We know that for some people it is not feasible due to health reasons, but this is rather rare. Some people might develop allergic reaction to materials, for which it might help if you change to another type of mask. And we know that people who have severe heart or lung problems cannot necessarily tolerate masks. But we know that many people with asthma, for example, can wear face masks, and it's for their own benefit. Helsinki provides masks at school for all teachers and personnel, and for lower secondary school pupils. That includes pupils who are younger than 50 years old. So these are free of charge. Helsinki distributes free masks to those who are in need. So if you cannot afford buying masks, go to the website, City of Helsinki website, and you will find several points where you can collect masks free of charge. About using masks, parents act as role models. So your attitude towards wearing a mask affects your children and youngsters. And of course, youngsters are very much affected by their peers. So when there is a positive attitude in their group, so that is very good and effective as well. Face masks should be worn while on free time. So it's not only the school and the school days or classroom, it's all the breaks and all the free time we have. We very often consider those who are kind of close to us, near and dear, not to be a danger. and they are not a danger, but that's the way the virus takes benefit if we have close contact with a person, even if a friend, and we don't wear a mask. So that is something I would like you to think about. And when we consider who is exposed to coronavirus, if we know there is a case of coronavirus, someone who is infectious, and we think who are the exposed persons, we take into account whether the person who is infectious or the person who is being exposed, whether they wore a mask. And if they have done, it reduces the likelihood of transmission, and sometimes we might consider that there's no need for quarantine. Then I've highlighted a couple of recommendations and restrictions that came into effect recently and are recommended for the couple of weeks onwards. In order to reduce the spread of virus, we should all meet less people. So when it comes to free time, it's not advised to meet people outside the household, and at least in indoor setting. All organized leisure activities have been cancelled except for outdoor sports for people under 20 years old. And when it comes to public events and meetings, so those are prohibited as well. And the very small gatherings for very important reasons might take place. But otherwise, it is very strongly advised not to see other people right now outside your household or in the very important setting such as schools are. Then about isolation and quarantine. So a communicable disease control physician, such as myself, may order an infectious person to be isolated if she or he has been diagnosed with any generally hazardous infectious disease, such as COVID-19, this new coronavirus infection. Isolated person might be symptomatic, or then they might be asymptomatic, but they are someone who is able to transmit the disease onwards. And we are talking about quarantining person when a person is exposed to someone who is infectious, but this current quarantined person, him or herself, is usually asymptomatic. The aim of these isolating and quarantining is to prevent further transmission of the virus, so to stop the spread. And these are decisions that a municipal, such as myself, or a hospital district communicable disease control physician decides on, and it's based on the Communicable Diseases Act. As by these decisions, we had the power of limiting a person's personal freedom of movement. So these are not taken lightly, and they are always done in an individual way. So we have to assess every person and think, do we have a right to limit this person's freedom for a limited period because of the common good? And what we are doing here at the Epidemiological Operations Unit, we are doing contact tracing. And what the aim is, we want to find those people who are exposed by the disease, the person with disease, and we want to find where this person got his or her infection. That is the way to control the epidemic. We have looked our own data from this autumn, or this is from beginning of July till late October. And we have looked what is the risk of developing a disease for those who have been exposed by someone who has the disease, and in a different type of settings. So here on the left, we have the settings, then we have the numbers of the exposed persons, and then number of cases these exposed who have gone on to develop a disease, and then the likelihood or proportion of people with disease. As we can see, we have had, luckily, very few cases at school. So I have circled the primary and lower secondary school cases. It's around 1% that of those who were quarantined in that setting that eventually went on to develop a disease. If we consider the other settings, I've circulated household, so the same home or other close contacts. And then we are talking about a much higher risk. So household setting, 19%, and other close contact, 7% risk of developing a disease. And as I've said earlier, so this is droplet transmission, and it requires rather close contact most often for the transmission to take place. And one thing about this data set, that this was a time when using face mask was not common. So we didn't have that protection affecting what we saw. We have done screening at schools in Helsinki. So screening for those who have not gone for a test because they have developed symptoms, but who have, in our understanding, might have been exposed and in a risk of developing disease. And we wanted to see how many of those were asymptomatic yet infected with the virus. The screening that I'm presenting here were done by PCR test. So in the spring, we did screening in one comprehensive school, and during the autumn in 4 comprehensive schools and 2 upper secondary schools. Altogether, we had 416 pupils or students who were invited, and 151 staff members. And for all this screening, we had some special reason to think that there might be higher risk in those groups. So we had either several students or pupils or adults that were infectious, or we had someone who was infectious for a quite long period, or some other reason to believe that we would find, we're likely to find asymptomatic cases. Of those who were invited, I'm happy to say that very many participated in screening. So for pupils, it was 75%, and for staff members, 88%, who went on to have their sample taken. We had very few positive findings. So altogether, we had findings in 3 schools and 4 pupils or students, which was little over 1% of screened were found positive through screening. And of those 4, 3 actually were symptomatic before test, so they were not asymptomatic carriers. So we had 1 asymptomatic we found out of 313 screened. And when it comes to staff members, we found 4 cases, and of those 2 were symptomatic before test and 2 were asymptomatic. So this gives us good understanding that there is not a lot of asymptomatic cases in our schools when we have exposure in a classroom, even when we have several students who have been diagnosed, or we have someone there for quite a long period. And when it comes to school surroundings and students or adults in the school surroundings and their infection, we do, as we always do with coronavirus, we do a thorough individual assessment. So we think, who are the people that are close contacts to these people with disease? So we do the thorough process as we normally do, and it's in the school setting and it's outside of the school setting, and we do the assessment. And everyone who in our investigation or assessed by our assessment identifies as a close contact is and will be quarantined. And then we have to consider what is the likelihood of the other people who are not necessarily very close contacts, their risk of going to develop a disease. And these findings we have to keep in mind when we make our decisions. So we do individual assessment, we always look at the situation, and we do as good decisions as possible. And we have to keep in mind that we are limiting personal freedom, so we have to have a good basis for that. And one more thing about the school setting is that we know that when transmission takes place, it's usually from an adult to a child and not the other way around. So adults and older youngsters, they are more able to transmit than small children, and that is something that we have backing in and understanding in the sort of general literature as well. So using face masks by adults and youngsters, it's a very good thing in the school surroundings. So I think I'm handing over to Mario, and what I would like to say that I think what our aim is to do as good work as possible in order to enable the work at schools, which we all very highly appreciate, to go on. It's very important for our children and youngsters to be taught and to receive education, which is a privilege in this world, I would say. So thank you for listening.
Thank you, Sanna. And really, I agree with you that it's a privilege to have a good quality of education, and we do our utmost best to keep our children in schools in the safe environments. So now I will go through about the teaching arrangement during the COVID epidemic and answers the questions you have sent to us related to this issue. We follow strictly the hygiene and safety instruction given by the Ministry of Education and Culture and the Finnish Institution of Health and Welfare. We keep safe distance, remember coughing ethics, and wash our hands. We ensure safe learning and teaching in different subjects by keeping distance. Staggered lunches, maintaining safety distances. The pupils learn mainly in their own study groups, and in PE, we avoid contact sports. School staff and pupils of the 7th to 10th grades are strongly recommended to wear face masks at school. And the school provide pupils with masks. They can use their own masks as well. We observed continuously the corona epidemic situation together with the epidemiological units. Basic education is provided as contact teaching. It's child's right, and comprehensive school is compulsory education. Related to this, we have received questions about distance learning. We can't go to distance learning in advance or just to be on the safe side. According to the Basic Education Act, switch to distance learning must be inevitable in current COVID-19 situation. If it is inevitable, we make the decision of exceptional education arrangements based on the Basic Act, Section 20A. Pupils are learning remote or in hybrid model. So far, this fall, we've made this decision for 4 schools in Helsinki. In Helsinki, it hasn't been necessary to move to distance learning citywide. According to the Basic Education Act, grades 1 to 3, special education and preparatory education pupils are always in contact classroom instructions. We've got also suggestions of lengthening the Christmas break. This is not for the City of Helsinki to decide. According to the Basic Education Act, the school year is 190 working days, and the school year must end on the last working day of week 2022. This frames our academic year, and we can't make exceptions. If we have a longer Christmas break, then we need to keep, for example, the winter holiday in February shorter. There has also been questions if a family can discharge their child from school. Being absent from school requires permission. Leave has to be applied for the absence, providing the reason. Absence policies at schools are following. Extra holidays must be applied from school using the Wilma application as per usual. School makes the decision on the pupil's absence. Pupil gets the homework through Wilma, and the guardians are responsible for the pupil's learning and school work. There has also been questions of homeschooling. It is a different thing than being absent from school. Homeschooling means that the guardian takes full responsibility of the child's learning and entire compulsory education. Some pupils have been placed in quarantine, and there are pupils in the risk groups. With these pupils, we will follow special arrangements. On guardian's request, a decision will be made according to the Basic Education Act, Section 18. The guardian can also request special arrangement if a child or a family member is in the risk group. In special arrangement, we will provide a pupil with distance learning. You get more information from your child's school. As said before, during this fall in Helsinki, it hasn't been necessary to move to distance or hybrid learning citywide. We observed continuously the corona epidemic situation together with the epidemiological unit. Next, I will show you where you can be in contact if you have further questions of school arrangement or corona epidemic. There's a website where you can go, and then we have a help lines working on daily basis in Finnish and English from 9 a.m. till 5 p.m. You can find the numbers there, and there is also services provided in Swedish on Wednesdays. I wish you all good evening, and thank you for attending this virtual info event. We wish that this clarified the impact of coronavirus on our schools and the teaching arrangement. Thank you.